When it comes to caloric intake and caloric absorption, what we take with normal anatomy, all of it is absorbed. With the sleeve gastrectomy, because of the scaled reduction in the size of the stomach, we take less calories, but all of it is absorbed. With the duodenal switch operation, we would take as much of a calorie by mouth as with the sleeve, but a lot less of it is absorbed because of the bypassed, rearranged part of the small bowel that limits our absorptive capacity. With the adjustable gastric banding, both solids and liquids can go through the adjustable gastric band independent of how much fluid it's in there based on individual patient. Patients that are having significant nausea and vomiting with the band, they will develop the habit of tolerating taking in a lot of liquids in order to be able to tolerate some sort of food. And any liquid that goes down through the band will get absorbed at 100% just like normal anatomy. So patients that resort to high calorie protein drinks, high calorie liquid drinks, smoothies and so forth and so on, they may be consuming in a setting 1000 calorie with the band, and they will absorb 1000 calorie because independent of how narrow the band is, liquid will continuously go through. Similar thing also happens with the gastric bypass operation. With the gastric bypass operation, there's been a lot discussed about the size of the stomach and the size of the opening between the stomach and the small bowel dictating the amount of weight loss, and that has been for the most part disproven that the size of the stomach and the size of the opening between the small bowel within reason does not dictate how much a patient will lose and how much of it they'll be able to keep off. And the rationale with this is that though, depending on whether a patient eating solid or liquid, they may eat a certain amount of food and they may absorb about the same amount, give or take, when it comes to gastric bypass operation. And the numbers that I've put on here are just to keep numbers very, very simple for mathematical purposes for us to be able to do the math. But the standard gastric bypass operation does not rely on reducing the amount of absorption, but only relies on reduction of the amount of food that a patient can take in.